If you've already watched my earlier video on the 4 subtypes of stage 4 melanoma, M1A to M1D, welcome back. If you haven't seen it, you might want to check that out afterwards. Today, we are focusing on something slightly different, the moment when melanoma cross from stage 3 to stage 4. And especially when it shows up in just one place and why they are the same. That step can feel uncertain, and understanding it can make a big difference. If you or someone close to you has recently moved from stage 3 to stage 4 melanoma, you're not alone and you're not without options. I'm Dr. Chris Ho, and on this channel, we have already looked at how stage 4 melanoma looks, very different from what it was a few years ago, thanks to immunotherapy, better planning, and more targeted treatments. Right now, let's gently unpack this next step, stage 3 to stage 4, and what happens when the cancer spreads to just one area. That's what we call a solo spread, or a single organ involvement. It can sound frightening, but I want to show you why this stage, especially when caught early, still comes with real hope, real options, and real life to live. What's changed here? At stage 3, melanoma has already moved into nearby lymph nodes, but it's still considered regional spread. Stage 4 means the melanoma has traveled further beyond the skin and local lymph nodes into a more distant part of the body. This could be under the skin elsewhere, to the lungs, liver, bones, or brain. Here's the part that many people don't realize. Sometimes melanoma spreads to only one area, and that might be just the skin. So that's called M1A. Just the lung, M1B. And even just a spot in the brain, M1D. These are known as solo patterns of spread. They are still stage 4, but they are not all the same. This is important because the type of spread helps guide treatment and shape your outlook. When it's just one or solo type stage 4, let's say your first scan shows melanoma in the lung and nowhere else. That's called M1B, lung only spread. Or maybe it's under your skin, of your back, of your arm, but far from the original spot. That's M1A. Or a scan picks up a small brain lesion caught early. That's M1D. All of these are considered stage 4, but they behave very differently to widespread disease. Why they go solo? That depends on the tumor type itself, the original melanoma that you had on the skin. These solo types are often slower, more localized, and highly responsive to immunotherapy. And in some cases, small surgeries or radiation can also play a role. Many patients with single area spread do very well, with long periods of control or even remission. So even though the word stage 4 sounds final, these cases remind us it's not all the same story. And if you're facing the shift from stage 3 to one of these solo stage patterns, please don't assume the worst. Your journey might still be long, meaningful, and full of living. So what should you expect next? First, you'll likely start systemic therapy and usually the immunotherapy that activates your immune system to attack the cancer. This is the same double treatment, dual immunotherapy that we discussed in our earlier video, and it's now the standard care across Australia. If your melanoma has a BRAF mutation, your team might also target it with tablets in reserve as a backup. Depending on where the spread is, if it's skin, you may also have injections or minor surgery for that lesions on the skin. If it's the lung, M1B, you might even be offered precise radiation or even surgery. If it's M1D, in the brain alone, the team may add focused brain radiotherapy, stereotactic radiotherapy, precise, plus your systemic therapy. This is where a specialist melanoma unit can really help. They don't just treat the disease, they help plan your journey, manage side effects, and connect you with support. You don't have to figure it out all at once, and you're not expected to be an expert. This stage, solo organ stage 4, is serious, yes. But it's also a window of opportunity. Treatment today isn't just about survival, it's about preserving your quality of life. It's about buying time that feels like your life again. So, here are 3 things I encourage to focus on. 1. Stay in rhythm with your scans. Don't postpone them. They help guide every step. 2. Speak up early if you notice symptoms, headaches, breathlessness, anything new. And 3, very important, ask your team. Talk to your team. Can be about trials, options, realistic goals. In having a plan, it will give you strength. And remember, this is still your life. Cancer might be part of the story, but it doesn't get to be the whole story. So if you've just moved from stage 3 to stage 4 and it's a single organ spread, know this. You have options, you have treatments, and you still have time to make good memories. Do things that matter, stay connected to the people, family, and friends, and make moments that make life worth living. If this has helped you understand your next step, there's more to the channel. You'll find follow-up videos that will go deeper into each stage 4 pattern, like brain only or liver only involvement, if and when you're ready for them. Let me know in the comments if you'd like to know more specific questions. We'll continue to break this down slowly, clearly, one step at a time. Stay hopeful, stay curious, and above all, be kind. Be kind to yourself.